I'm Dr. Sue Decotiis, and I have a medical weight loss practice in New York City, in Manhattan. And so many of my patients have been so successful on GLP-1 drugs, such as Tirzepatide, which is Mounjaro, Ozempic, which is Semaglutide, um, Zepbound, which is also Tirzepatide, and Mounjaro. And so many patients have lost so much weight, and we make sure that they've been successful because we follow them on a body composition scale to make sure they've actually lost fat. And when they get to their ideal weight and their ideal body fat percentage, the question is, how do I keep this weight off? And that's a really great question. So what we do is, number one, we make sure that their body fat is down into an acceptable range. And for women, that's about 20%. For men, maybe mid-teens. And we taper them slowly. And when they're ready to get off the medication, when we feel that their weight is really stable, then what we really suggest that they do is they continue the diet that they were on with the medication. And that's basically a very high protein diet. So for most people, they're going to need 80 to 100 grams of protein a day. And that's a lot. And you also want to make sure that you have a lot of fiber. So with the vegetables that you eat, make sure they have fiber. Things like broccoli, spinach, small portions of yams. And you want to make sure, if you could, that you really just eat twice a day. You don't want to graze. You don't want to be eating all day, because that taxes insulin. That makes insulin have to get up and work. And what we really want insulin to do is just to burn fat for us. So a high protein diet, making sure that you are counting those grams, keeping up with hydration, and getting a decent amount of exercise, especially walking and resistance training. And then follow up with your physician. In my practice, we really see people frequently after they've lost the weight, just to be sure they keep it off. Thank you so much, and keep it going, okay? Keep that weight off.